trend upwards. Yesterday, the province confirmed 864 new cases, and almost one-fourth, or 209 of those new cases, were found in fully vaccinated Ontarians. Raywat Deonandan has been watching the so-called breakthrough infections closely. He's an associate professor and epidemiologist with the University of Ottawa. Good morning. Welcome back to the show.
Good morning.
As more and more Canadians get vaccinated, we're still seeing these case counts rising, including among the vaccinated. Why is this happening?
It's something called the base rate fallacy that people need to understand. It's a statistical illusion. Here's how it works. The more people that get vaccinated, then that tiny fraction of the vaccinated who experience breakthrough infections will be more and more represented in the data. So consider that about 100% of people wear seatbelts now when they're driving. So the fatality rate of car crashes has come down, but hasn't come down to zero. So amongst those car crashes that still have fatalities, 100% of those fatalities are among seatbelt wearers. Doesn't mean seatbelts don't work. It just means everybody wears seatbelts. So consider a population that is 100% vaccinated. Those cases that do occur, and some will occur, will be 100% amongst the vaccinated. So as more people get vaccinated, expect the proportion of the infected that we know about to be more and more vaccinated. That's not a bad thing necessarily. So, but right now what we're seeing as this pandemic rages on is the vast majority of cases are amongst the unvaccinated because there are still many of them out there, and they're going to be the ones getting the sickest. So when it comes to comparing vaccinated and unvaccinated, I encourage people not to look so much at the proportion of the hospitalizations or infected that are vaccinated versus unvaccinated, but rather the proportion of vaccinated who are infected versus the proportion of unvaccinated who are infected. And if you do that, the risk is like an order of magnitude different. It's far more risky to be unvaccinated. And then amongst the breakthrough infections, CDC data suggests that 30% of those will be asymptomatic, 60% will be mild. That leaves like 10% that might be a little serious. And that's what we care about, but that's a far lesser risk than being unvaccinated.
But what do you say to people who said, look, I thought being vaccinated was foolproof. I thought it was going to be a total barrier to getting it.
That was never going to be the case, first of all. Vaccines rarely provide what we call sterilizing immunity. That's when the vaccine prevents you from getting infected in the first place. Very few vaccines do that. If you look at a vaccine like the rotavirus vaccine, that does not prevent asymptomatic transmission, but yet it has reduced the cases of rotavirus by 90%. You rarely see it now. So it's possible to push this disease to the margins by only preventing serious disease. Now, the COVID vaccines do prevent transmission to some degree and to a high degree, depending on the variant you're looking at. But you've got two arms of your immune system. One produces antibodies, and that's what prevents these infections from happening in the first place. And the second produces T cells and other kinds of immune reactions that prevent the disease from manifesting. That's what we really care about here. So vaccines still, over 90%, 95, 96, 97%, prevent hospitalization and death. It keeps you out of the morgue and keeps you out of the hospital. That's what we care about.
Who is most at? I'm just sort of absorbing that because those are pretty strong words. It keeps you out of the morgue. That's a good thing. Yeah. But who is most at risk for being one of this minority that gets this breakthrough infection?
So who are these people who get breakthrough? It's a good question. We don't entirely know. The assumption is they're mostly going to be people who didn't mount an immune reaction with the vaccine. And that tends to be the immunocompromised and also the elderly who have, lesser strong immune systems. That's why we advocate for those two groups to get a third booster shot to really ratchet up their potential for neutralizing antibodies to be produced. But I like to say we don't really know who is going to be infected or experience a breakthrough infection, so we try to reduce our exposures for everybody. Consider the analogy that vaccines are more like wearing rain boots when the floodwaters are high. So as long as the lip of your rain boot is above the level of the water, your feet don't get wet. But when the water level rises above the lip of your boot, suddenly your feet start getting wet. So when there is sufficient virus circulating, it finds holes in our defenses. It jumps over that wall, and some people are going to get wet, i.e. infected.
It's interesting. Yesterday here in Ottawa, there were 8 active COVID-19 outbreaks in childcare settings in Ottawa, including a new school outbreak for the third day in a row. I know that parents everywhere are worried that we're heading to remote learning yet again. Can you Can you comment on this? Are you hearing this, or do you have your
Yeah,
own concerns?
I hear. I'm deeply concerned, of course. And the thing is, all of this was avoidable and still might be avoidable. It's avoidable if we really ratchet up vaccination so that all of the adults that these kids get in contact with are vaccinated, so the probability of facing infection is lower. If we invest in other mitigation tools like better ventilation, high quality mask wearing, and so forth. If we use rapid testing that we haven't been using as much as we can and should, to remove infectious people from circulation on a given day, we lower the probability of creating outbreaks. Now, kids, we still don't think that kids are going to get as sick as adults would have. But this is a numbers game, and Delta is so transmissible that it's going to infect so many people that the raw numbers of individual children who get seriously sick will be higher, even though the proportion might not be. So it is concerning. But my hope is that we continue to invest in the strategies and tools needed to prevent infection in schools.
I've heard you say that this is now a human problem, not a viral problem.
Yes.
Really?
Yeah, well, in the sense that we've had the tools now for months to control this. We just don't use them. It's almost a human choice. A year ago, we were at the mercy of the virus. A year ago, we didn't have vaccines and rapid tests and some therapeutics and understanding of spread. We understand all those things now. We've had time to prepare. So it's mystifying to me that we haven't made ventilation improvements in schools, that we haven't sent free N95 masks to all families, that we haven't accepted vaccine everyone if we're eligible. So there are things that we have now that we should be using to make our lives normal and safe that we're not using. It's mystifying to me. Not entirely mystifying because human psychology is complicated, but it is a matter now of choosing to use the tools or not. And so far, sufficient numbers are choosing not to use the tools that we're still in crisis.
Are you following what's happening in Alberta?
Yes, I am.
On Wednesday, Alberta was put under a state of public health emergency. It has its own sort of variation on the passport coming in. It's asking for help from other provinces. What lessons do you think we can learn from what's happening out there?
Yeah, so a number of lessons. First lesson is the places that have done well with this disease for the last 2 years have three things in common. Number one, they got really good at case detection. Number two, they got good at monitoring their borders for not importing infection. And number three, most importantly, they acted early, they acted hard. Alberta did not act early, did not act hard, and kind of avoided and ignored the data signals that they should have been paying attention to. In particular, their modeling was based on UK data, during which Alpha was the dominant variant, whereas it was clear that Delta was going to be dominant. So there was a lot of hope, but hope is not a strategy. And as people are saying, just because you're done with the pandemic doesn't mean the pandemic is done with you. So I think we're well advised to keep our feet on the pedal until we have sufficient immunity in the community. Alberta has low vaccine uptake rates, just above 60%, lower than 50% in some regions. So it was always a bad idea to lift mitigation tools while vaccine uptake was so low.
Raywat, thank you as always for your time.
Thank you.
That's Raywat